Good evening. My name is Mike Kelly. I'm a firefighter paramedic with the City of Concord and a member of Local 1045, which is the union that covers the firefighters within the fire suppression division. So those are the personnel on the fire engines, the ladder, the ambulances in the city. And I'll let Steph.
I'm Steph Costello, firefighter paramedic, also with the City of Concord. Happy to be here. Happy that you all showed up tonight. Thank you for coming.
With stroke and heart attacks and cardiac arrest, minutes really matter. So having advanced life support there quickly can make the difference. The biggest thing that makes a difference is good quality CPR before we get there, because without it, a patient is in theory just laying there, not getting circulated blood, not getting blood to their brain, and as we know, about 4 minutes brain damage can start to occur. So even if we do get a pulse back, typically the outcome is not full functioning afterwards. So let's talk about when and why we would do CPR. Can anyone give me a situation where we might want to do CPR?
Someone's unconscious and they're not breathing.
Sure, someone's unconscious, not breathing. That's actually the biggest piece of hands-only CPR is they've kind of taken away the fact of, do they have a pulse, do they not have a pulse? Have you been specifically trained on where to find pulses on other people? Probably not. So when the opioid epidemic sort of spiked in New Hampshire, they were finding that a lot of people weren't helping, people that were unresponsive, they weren't breathing. So they said, if you see someone on the ground, they're not conscious, they're not moving, you quickly check them. If they don't seem to be breathing, or breathing minimally, you just jump on the chest and start doing compressions. And even that motion is enough to move maybe a little bit of air in and sort of help facilitate movement of air until rescue can get there, okay? So the first thing we do is when we see someone that looks like they might need help, is just go up there and check them. We often get called to people that drive by and see someone laying on the ground or sitting in a car. They're like, this guy's unresponsive. And then we show up in a fire truck and an ambulance and we knock on the window and the guy wakes up and he's just sleeping. So certainly check people, see if they need help. A lot of times people just close their eyes, or it seems to happen more so in like some of the cities. People just seem to want to lay down where they want to lay down. So just check on them. Just go up, sir, are you okay? You don't need to do anything crazy. Obviously your safety is important. So if it feels like it's unsafe, we don't want you guys to put yourself in that situation. Certainly just call 911. And if you can stay in the area so that way you can direct us to where we need to be, that's very helpful. But if you feel like it's a safe location, the situation seems okay, certainly go up. You can tap them. One thing I try to tell people is like tap them on their feet. If someone is actually sort of passed out or unresponsive and they do wake up, they sometimes are startled. So you might have to get someone swinging their hands a little bit until they realize what's going on. So getting a foot, tapping on a foot, sir, shouting, yelling, that sort of thing. If there's no movement, come up to the victim and really you're just gently tilting their head and you're looking to see if breathing. We used to talk like get down close to their face, feel breath on your face. Like we don't do that stuff anymore. You don't want someone's breath coming into yours. So as long as if you don't see any chest rise, someone laying there and their lungs are expanding and they're not waking up, we just go right to CPR. Okay. You can certainly check for a pulse in larger kids and adults. You can check a pulse right on the side of the neck. The problem is if you're not specifically trained on where it is, it can sometimes take someone a while to find someone's pulse, especially if they're maybe have a medical emergency going on. They've used, if they may be on a drug, like a drug overdose, it might be a little bit more faint. So you may not feel it. So typically 5 to 10 seconds is the most that we check for a pulse. If we can't feel a pulse within that time frame, we just go into compressions. Okay? So compressions, for the most part, it's gonna depend on the person, how big they are. They generally are fairly easy. The bigger the person, the harder it is to compress their chest. But you wanna center in this, you wanna locate the sternum, or they may say the breastbone on certain courses, and then you wanna push about on the bottom third of the sternum, okay? So pretty much in between anatomically where the nipple line would be. So if you were to draw a line across, right there in the center of the chest. As we get into kids and infants, we don't use two hands. If you're a big guy and say it's a very frail, elderly, older person, you may only want to use one hand. Just to avoid any significant trauma to their musculoskeletal system. But we compress about 1/3 the depth of someone's chest, at least 2 inches, okay? So it's not just this, you really have to push into it, all right? And what we're trying to do is push the sternum against the spine to push on the heart, okay? The heart, as you squeeze it, the blood pushes out. When you release, the blood comes back, and that's what keeps blood circulating around the body. So when someone's in this condition and they're not breathing, we actually we don't use all the oxygen in the breath that we take. So the room air oxygen right now is roughly 21%. We take a breath in, we only use about 5% of that 21%, and then we breathe out the other 16. So if there's air in the lungs and we're actively doing chest compressions, they still are getting oxygenated air circulating through their body. It may only last a couple minutes, but at least it's something. That way you don't have to do mouth to mouth on someone you don't know. All right. So we determine that we need to do chest compressions. We find our location, as I said, about the nipple line. Sorry, I took your mannequin. I'll give it back to you in a second. Right in the center of the chest. On the typical adult, we want to use 2 hands. You can interlock your hands like this. I typically put my hand over the other one just because it's not comfortable for me. You're going to just practice and see what works for you. The other thing you want to do is you want your body weight to help you compress so that you're not doing this, which is going to make you tired a lot more quickly. Okay, if I'm sitting here doing this, I'm going to tire out much more than if I get my shoulders over and I use my weight to compress down on someone's chest. Make sense? We also don't generally do CPR on a table, so get them onto the floor or a hard surface. Don't do CPR on a bed because you're just pushing the person down into the bed and not actually compressing the heart. Okay, so that's one thing that we sometimes see when people do CPR at home is they find a loved one or a friend in a chair, on a couch, in the bed, and they just start compressions wherever they are. The first thing you need to do is get them down to the floor. All right, and you want to lay them on their back. And then once you find your location, you're just going to do compressions until we get there. That's it. We do compressions at a rate of about 100 to 120 beats per minute. There's a ton of different things, using different songs like Staying Alive in your head. Does anyone watch the Office and see the CPR episode? He was like, at first I was afraid. Don't do that song, all right? You gotta go a little bit faster. Just do compressions, and as long as you're doing at a pretty good rate, we're 1, 2, 3, 4, 5, 6, 7, 8, like that is roughly between 100 to 120 beats per minute. If we do too slow, we're just pressing on the chest and not actually creating enough pressure in the system to push blood around. And if we do it too fast, we're not allowing the heart enough time for blood to come back into it to fill up to then compress down. So we're just pushing small amounts of blood through the system, if that makes sense. Okay?
Child's really not much different.
Yeah.
The depth of your compression is going to be obviously less because usually their chest depth is smaller. So a third of the depth of the chest, or like 1.5 inches. You may only need one hand, like Mike was talking about, to get that compression.
Yeah, so this guy is a child. He's not much smaller. In fact, he's a really manly looking child. Obviously kids are smaller, so if you're a bigger person, you may only need to use one hand. Even for some of your smaller adults, one hand might be enough. As long as you're compressing about a third of the depth of the chest, or about 2 inches, then that's adequate. So if you don't need to use 2 hands and you can just use one, then you can do that. So that's typically how we teach a child CPR, is just the one-handed, but it's the same same sequence.
Yeah, yep, same sequence.
That makes
same
sense.
rate.
So where it gets different is the infants. So everyone good with that? Really just from about, I'd say, 1 year old and up is just chest compressions, either one hand or two-handed.
Baby, we're going to start with airway obstructions. I know you guys are worried about that. Obviously very common with kids. They get and put things in their airway that get stuck. They have very, very tiny little airways. So with kids, obviously you're going to notice they're turning blue, they're not crying, they're not making noise. You may have seen them put something in their mouth. So baby, are you okay? Nothing. So what I'm going to do for the baby is kind of use 2 fingers to support the face. The palm of my hand is on the baby's chest. I'm going to use gravity to my advantage and put baby's head down, thinking that that might help the object come out. I'm going to give baby 5 really good back blows. They're doing this to save their life, so it's kind of okay to hit the baby in this situation, all right? So 5 good back blows. I'm going to support the head and the back, and then I'm going to do 5 little chest thrusts for the baby. Kind of like CPR, same position. Your fingers are kind of middle of the chest, nipple line. 5 little compressions. You're going to do that back and forth. Check in the mouth every time you flip baby over, see if that object has come out, if you can sweep it out. They're good solid back blows. Like, we're not giving baby little back rubs trying to get it to sleep. Like, we're trying to change the pressure in the chest to force out whatever is stuck in their airway. So why don't we go ahead and give that a whirl. So like Mike was saying, a lot of times with kids, it's a respiratory issue. It can be after they've been choking on something. So he's talked briefly about with children, we're going to do a round of CPR before we call. So same thing with the babies, do some CPR before you make a phone call or send somebody else to make the phone call. So for babies, are you doing the 2 hands encircling? Is that or 2 fingers? Okay.
I prefer 2 fingers myself.
Okay, so there's a couple techniques with baby. Obviously, if they're small enough and you can get your hands in their armpits and use your thumbs on their chest, you can do compressions that way, squeezing the baby. And the other way we can do it is just 2 fingers on the chest, pressing again a third the depth of the chest. So obviously a smaller infant is going to be less, more like 1/2 inch to 1 inch, whereas a larger one is going to be a little bit more. So same thing, same rate, just keep squeezing the chest. 2 thumbs encircling or 2 fingers, whichever is more comfortable for you. And again, until you get tired. We're not teaching breaths with babies in this. Perfect. So yeah, just go till you're tired. Make sure you do call 911 if you do start CPR and baby's not regaining consciousness. Don't forget to start EMS because it's going to be a long time of you standing there doing this if you don't call for help. So
Maybe, I don't know if you want to just briefly touch on the mouth-to-mouth piece. So we typically do not encourage people to do mouth-to-mouth resuscitation, especially if it's someone you don't know. Personally, if it's a small child and it's a family member, I'm probably going to do it.
absolutely.
So it might be
Yeah, sure. So with a baby, an infant this size, you want to cover both their nose and their mouth with your mouth, or pinch the nose and cover the mouth with your mouth. And you're just going to give a tiny little puff. So if you think about just taking in a tiny little breath without puffing out your cheeks too much, that's how much air you're going to blow into the baby. 30 compressions and 2 breaths is one way to do it. If you have 2 people there, you can do 15 compressions and 2 breaths, have the other person do the breathing part. Babies do need that oxygen and that air a little bit more than adults do. They have a higher respiratory rate and need that. So if you're able to do that and you're willing to do that, absolutely go for it. Very easy skill to do.
If I'm doing CPR, I might ask Steph to grab the AED for me.
This is a training aid. It's not me. So things are sticking.
Attach pads firmly to person's chest as shown.
Firmly.
Analyzing rhythm. Everyone stand.
Stay clear.
It's a long time.
Shock advised. Charging. Everyone stand clear. Everyone stand
Everyone clear?
Push the shock. Shock delivered.
Come back.
Begin 5 cycles of CPR.
And that's it. I mean, this thing will tell you everything. And if you're on the phone with 911, they're also going to tell you how to do CPR as well. So that's the nice thing about our system, is that it is designed to help you as a layperson. If you call, make sure you stay on the phone, put it on speaker, put it right here. All right, I'm starting CPR. And they'll sit there and they'll actually count for you. And they'll be like, 1, 2, 3, 4, 5. 1, 2, and it basically keeps you on track. They have a whole system. They'll ask you for specific information. What do you see? What did you find? And they're relaying that typically to us so that we can make sure that we bring the right equipment into your house or up in an apartment, something like that. I feel like we don't need to necessarily go through putting stickers on someone. I think everyone kind of get the idea.
Follow the instructions.
Just follow the instructions. The big thing is turn that thing on as soon as you get it, and it'll start prompting you on what you need to do. So it takes the guesswork out of, what did that guy tell me that one night? I was like, what do I have to do? This thing tells you. And all of them do tell you now. So, all right.
Do razors come with the AEDs for the hair?
Yeah, good question. So typically, I believe most AEDs, when they come like set up as a kit, have some razors in there. Unfortunately, it sort of depends on whoever's maintaining the AED. There's batteries that need to get changed in the AED usually every year, every other year. There's the pads that do expire typically after 2 or 3 years. And then there might be a pocket mask in there to do rescue breaths, and there might be a pair of gloves, a pair of scissors, so you can cut someone's shirt off. These pads now are like super sticky, so even like a fairly hairy-chested person, you can still get them on there. If there is a razor and there's a lot of hair, you can just quickly try to remove as much hair as you can. It doesn't need to be like baby smooth skin. Like, it just needs to get the majority of it off so that it actually adheres to the skin. It isn't kind of like waving around on their hair. If there's several AED pads in the AED, the other way to do it, it's a little more barbaric, but it does work. Put the AED on and then rip it off like a Band-Aid. And it pulls all the hair off. And then you can put the new pads on. But only do that if there's a second set of pads. Because once you do it, you'll never be able to put them back on. All right.
What is the control, this one what?
Yeah, so these are just trainers.
Oh.
So this is actually for the instructor to say, okay, I want a shock, I don't want a shock. Typically, the only buttons you will have is what you see in the front. A power button and a shock button. That's it. So, and some of the other ones will actually have numbers of, like, if someone is hearing impaired, it will say 1, where the plug is, 2, push the, this button, stuff like that. So they've come a long way. All right. Anything else? Any other questions? Do you feel comfortable if you were to find someone laying down on the ground? Okay, I think I know what to do. Okay.
Comfortable is the word.
Comfortable, yeah. How about
Prepared?
prepared? Like, okay, I think I know what I need to do. So to recap, call 911, stay on the phone, check for responsiveness, Sir, are you okay? Shake them, grab their foot, move it around. If they're not, or check for breathing. If they're not breathing, just start chest compressions. Center of the chest, hard and fast, 100 to 120 times a minute, or beats per minute. Get the AED on as soon as you can. Follow the prompts. And then once the AED comes in, you're just like the machine that just has to keep doing compressions. It'll tell you when 2 minutes is up and it needs to recycle. For choking infants, 5 back blows, turn them over, 5 chest compressions, turn them back over, until the point where they are unresponsive, and then we go into CPR, just like we would for an adult. All right?
And you said if it's not an infant, it's just the back blows.
Yeah, typically if it's a larger child, you're not going to flip them back over or lay them on their stomach, or excuse me, on their back and do chest compressions and then flip them back over. Generally, back blows for someone like that is okay, and then you can get into the sort of abdominal thrust Heimlich maneuver, which we didn't really talk about. But if someone's conscious and they're giving you the universal sign that they're choking, we come up from behind them, we make a fist just above their belly button, and then we basically squeeze them in and up, trying to, lost your mic. I broke it.
It lasted long enough.
It lasted a long time, actually. So kind of bear hug them, and then I'm in and up, in and up. And you just keep doing that while they're still awake. Once they become unresponsive or limp, lay them on the floor, and then you just go into CPR. There's really 3 things that you need to do. One is it says apply pressure with your hands, all right? And that's, again, this is depending on whether you like your friend or not, but I would say put your gloves on if you can. But the first thing you do is just put direct pressure. And I'm like holding pressure just like I'm doing a compression on someone's chest, but I'm holding the pressure in there. And that's the simplest way to stop a bleed. Unfortunately, it doesn't stop generally major bleeding, but just like if you cut your hand in the kitchen, you hold a little bit of pressure with a paper towel, and in a couple minutes, it stops bleeding. Kind of the same theory. Excuse me. The other way to do it is if you have access to some sort of dressing or gauze, is to put that on it, or potentially push it down into a wound if it's large. So a lot of this stuff came out of the war in Iraq and Afghanistan, where most of the preventable deaths in those 2 conflicts were from people that were bleeding that didn't get stopped. So about 90% of the casualties that were preventable were from someone who did not stop bleeding. So it's as simple as taking this, some sort of gauze, a kitchen towel, I don't really care what it is, and you're just gonna push it into the wound. I know it seems really gross, and you might be like, I'm out of there, I don't like blood. That's fine. You could do this on yourself if you needed to. All these techniques you can do, including putting this thing on your arm by yourself. Fill the wound as much as you can with the dressing, and then you hold your pressure. And you just sit there and wait. And you don't peek at it, did it stop bleeding? Oh, it's still bleeding, I'll hold pressure. A lot of times these might take 20, 30 minutes for them to stop. Hopefully, we'll be there by then. 5, 10 minutes down the road, we should be there to take over for you. But if you're backpacking or hiking somewhere and someone falls, you may need to actually hold pressure for a period of time until it actually stops. If for some reason bleeding is so severe that it doesn't matter how much gauze I have, if I had 12 hands, it still wasn't going to stop. This is kind of like I'm thinking me using my chainsaw in my backyard alone when my wife's at work, even though she tells me not to. I'm like, I could easily cut my leg, right? As long as I have this, I can stop bleeding myself if necessary. There was a case actually out in the Seacoast area of a guy who was trained in the military on how to put one of these things on. He was using a table saw at his house. He was alone. He actually cut his arm off right in the middle of his forearm. And he ran to his truck, got a tourniquet, put it on. Then the guy took his arm and put it on ice. And they actually were able to reattach it in Boston like several hours later. Like this guy, I'm like, he's got no arm and he's running around his house with the tourniquet and saved his life. So these things do work. There's a couple different, there's a bunch out there. I will tell you, the commercial tourniquets, the ones you can buy, are way better than trying to make one yourself. If anyone was in the Boy Scouts, I'm sure they taught you how to use a cloth, wrap it up so it's nice and thin, use a stick to turn it. It does work, but you have to be very proficient at tying knots and making sure that it actually gets enough pressure to occlude the artery, because that's what this thing is doing. It's just pushing all your muscle and your tissue against the bone, and your artery's sitting there and it squeezes it and basically clamps off the supply so it doesn't continue to bleed in your leg or your arm. If you want to buy one of these, please buy it from a reputable source. Amazon is not a reputable source unless these particular ones are from North American Rescue. There's a lot of counterfeit ones out there. They're like $12. If they cost $12, it's fake. These typically go for about $30. But it has a clasp, it has Velcro, you put it around the leg, put it through the buckle, you pull it tight around itself as best as you can, and then put the Velcro in place. All right, now this isn't tight enough. It's tight enough that it's not going to move, but it's not tight enough that it's actually going to stop bleeding. So you need this. You need some sort of mechanical advantage, which is what this is. This is called a windlass or the rod. And typically all you need to do is turn it maybe 2 or 3 times. You turn it again. When the bleeding stops, you've turned it enough. You put it into this clasp right here, and this piece just goes across and keeps it from falling out. So there's a time on there. If you can put the time back in like Vietnam era, if you put a tourniquet on, they would say that you were going to lose your leg. Nowadays, you could have these things on for 6-8 hours and be totally fine. If anyone's had any orthopedic surgery ever, had a knee replacement, I guarantee you had a tourniquet on for the entire time of that surgery, and your leg's probably fine. So you're not going to lose a limb just from putting one of these on. So if you think something's bad, and you're like, oh man, I don't know if I can control it, I'm going to put a tourniquet on, that's fine. Especially if you're in the city limits or something like that, and we show up, I can take it off if I need to. But once you put it on, leave it on, let a medical professional evaluate it and determine if it needs to come off. So